Hello, everyone. I have a wonderful patient of mine. She's 8 days out from her surgery. And so let me ask you this. How you had 695cc implants. These are very large for someone relatively very young, such as yourself. You did not get like a full frank lift. You had what was that pseudo lift, where I removed that excess skin at the bottom. Now, looking at yourself now at 1 week out, or day 8, how do you feel that you look right now?
I think I'm surprisingly look very well. I was actually nervous for the binder, especially being very tight on me. I'm very shocked on the results. I thought I was gonna need a lift and I don't at all. They look very good for just being on 1 week.
Now we will continue to follow and see now between that excess skin, between the recoil of the skin and the breast tissue, between that excess skin removed, that pseudo lift, between the internal sutures that were placed that lift the breast tissue not only up but towards the midline, between the fluffing effect of the breast tissue now that there's not a foreign body compressing against the breast tissue, between the implants that were sitting on the chest that are causing some concavity effect. We will see how over the next several months, a year and a half, how things are going to pan out and how you are going to basically only improve aesthetically. Time will be only witness to that. Now, how was your anesthesia experience?
I was actually very shocked about the anesthesia experience because in the past I felt horrible. I've had to have Zofran, I vomit. I didn't feel the side effects from this anesthesia. I was able to get up and walk when I got home, and I didn't feel nauseous. I actually had no effects from the anesthesia, so I'm super happy about that because I've had horrible experiences in the past.
Sure. Now, when did you find out about breast implant illness?
When I started to have pain in my breast, I started to look it up online, and there was a whole group on Facebook, and I joined the breast implant illness group on there, and I started to read everybody's stories. Some doctors don't believe in it, some people do, but I just started doing my research on it online on social media.
Did you talk to other plastic surgeons before you decided to proceed?
I actually didn't. I was going to go with an assistant of my old plastic surgeons, and I decided against because a lot of surgeons want to just put another implant in or give an aesthetic look before their health. And Dr. Khan was really big in the health part, and that's what I'm interested in more so than the aesthetic look anymore.
Sure. And I will tell you, there's so many patients that I've met just in the last 1 month who have had like a full formal lift done by the previous or elsewhere. And I see the hypopigmented scar, the pins and needle around the nipple areola, the white scars. And you did not get any of that because you did not need it because of your whole overall presentation, despite what are 695cc implants. Now, you saw the extensive area of dissection on the chest wall. Now, remember, this is the ultimate proof, a video and pictures, high definition of the chest wall showing complete removal of the capsule plus the implant. That is the ultimate proof. Plus, you got the negative pathology report. Now, have you noticed any improvement in your symptoms of breast implant illness, if at all?
I know this sounds weird, but my vision was I have astigmatism and it's hard for me to see at times. I have glasses, and I've noticed a little change in my sight as soon as I woke up, actually. Obviously, right now, I'm still inflamed. Inflammation was a big problem for me when I had breast implants, but I have to, continue to heal. But my back feels great. My neck pain is like completely gone, and I have to see a chiropractor at least a couple times a month for that. So
now, as you can imagine, you're not carrying those implants around. Your back is definitely getting a break. Now, we will continue to follow you. You're local. You're not too far away, like 30 minutes or so. So we'll hear from you at approximately plus minus week 6 or 8, and then we'll follow your progress. Anything you want to share with anyone in regards to what your experience has been so far?
When you see a plastic surgeon and they're all worried about the aesthetic look, make sure you just do your research and look at the health, your health benefits of getting breast implants as time goes on, because it's something that you're gonna have to change in the future, and you're gonna have to keep maintaining, and you might your body might reject it like it does most patients. So just do your research when you are looking for a doctor.
All right. Thanks for sharing your journey.
All right, thank you.
Welcome.